Hello, I'm Stephanie Domet. I'm the managing editor at Mindful and mindful.org, and I'm delighted to be hosting this conversation with Alison Whitehead and Eric Schoomaker as part of the Healing Healthcare Summit. In this session, we'll be talking about high stress situations, PTSD, and burnout, and the role mindfulness can play in easing the experience of those high stress situations. And we'll be looking at these issues through a military lens, but as you'll hear, there's a lot of resonance for healthcare. Welcome to this session. I'm glad you're here. I want to let you know that you can purchase lifetime access to all our Healing Healthcare Summit content in a downloadable format, and you can do that by visiting mindful.org/healthcare. And now to introduce our guests for this conversation, Alison Whitehead is the program lead for the VA Integrative Health Coordinating Center in the Office of Patient-Centered Care and Cultural Transformation. She served as a Peace Corps volunteer in the Dominican Republic and earned her master's in public health from Columbia University. She joined VA Women's Health Services in 2010 as a Presidential Management Fellow. In September 2015, she transitioned to program lead for the VA Integrative Health Coordinating Center in the Office of Patient-Centered Care and Cultural Transformation. She leads development of programs and policies for integrative health implementation across VA, including yoga and meditation. Alison is on the board of directors of the Academic Consortium for Integrative Medicine and Health and is the immediate past chair of the consortium's policy working group. She's also a yoga instructor, a personal trainer, and a certified yoga therapist. And in her free time, she enjoys spending time outdoors hiking, running, biking, and playing soccer, or practicing yoga and meditation. Dr. Eric Schoomaker is also with us today prior to his retirement in 2012 after 32 years of active service. Lieutenant General retired Eric Schoomaker served as the 42nd U.S. Army Surgeon General and Commanding General of the U.S. Army Medical Command. He currently serves as a senior physician consultant for the Department of Veterans Affairs in the implementation of Veterans Whole Health. His principal interests are twofold: complementary and integrative health and medicine, emphasizing mindfulness in the shift from a disease management focused healthcare system to one that's more centered on the improvement and sustainment of health and well-being and leadership education. Eric is an internal medicine physician with a PhD in human genetics. In uniform, he held many assignments, including command of the Walter Reed Army Medical Center in Washington, D.C., the Army's Medical Research and Material Command, and Fort Detrick, MD, an Army Academic Medical Center, a community hospital, a deployable medical brigade, and 2 Army Regional Medical Commands. He's married with 3 children, and his family is his greatest source of joy. So 2 very knowledgeable and experienced guests with us for this conversation. Hello, Alison. Hello, Eric, and welcome both of you to Healing Healthcare.
Good morning. Great to be back, Steph.
Great to see you again. I really want to thank you both for being with us today. And I want to be sure to pin our conversation in time for context because we're in this rapidly changing moment. So I'll say that we're recording this conversation on the morning of January 11th, when we're in the midst of an Omicron surge. Daily COVID case counts are high. Our already burdened systems are increasingly overloaded, and the people who work within those systems are certainly being pushed to their limits in every way. And as I introduced this segment, I mentioned that there's some resonance between a military service person's experience of stress and burnout and a healthcare worker's experience of it, particularly in our current context. Eric, what goes through your mind as you consider what healthcare workers are facing right now?
Well, quite candidly, and I think in an earlier conversation you and I had, and Alison and I have, many of the features that the population at large is facing today in the country and in the world closely resemble what combatants in a wartime setting experience. There's a threat to personal safety and to the safety of families. Many of our healthcare workers today may have been trained or came out of an environment in which we took for granted that we were not going to be threatened by the very things that our patients were suffering from. I mean, unless you were around in the early 80s during the onset of HIV/AIDS, or were involved, let's say, in the treatment of Ebola, you probably didn't associate being a caregiver with having a threat to personal well-being, and certainly not to your family. You wouldn't take something home. But in fact, that's a long-standing, I don't want to say tradition, but reality of what healthcare workers are. I mean, some of the very last people who contracted smallpox were healthcare workers in the United Kingdom, taking care of immigrants coming out of Southwest Asia and that area of the world. And tuberculosis was always a threat to healthcare workers. I think the other is this highly unpredictable and chaotic environment we find ourselves in which one watches not only patients experience isolation and suffering, often dying, very much in parallel to what soldiers on a battlefield have to experience. I mean, if you think about this, combatants who die in combat die alone, or at least without family. They die with their compatriots, but often without family, and most often without family around, in an isolated sort of setting. But this chaotic environment that we find ourselves in which is punctuated by conditions that we know degrade human performance and human spirit, such as sleeplessness, physical and mental exhaustion, frustration, and a sense of futility, is oftentimes what people experience, in a battlefield setting. And so I liken this in many respects to the pressures and the stresses that people in uniform feel. And not surprisingly, one of the reasons I got so interested in the work that Alison is doing and the Office of Patient-Centered Care and Cultural Transformation is that they've taken the lead on transitioning service members who experience this while in uniform for either a short or a long time into veteran status, and carry with them the memories and the scars, psychologically and otherwise, of having experienced that. How can we continue to help and assist people once they make that transition? And the last thing I'd like to say is two things. Number one is I always have to say that, although I'm grateful for that very generous introduction, I'm blessed to be married to another Alison Whitehead. My wife is a yoga therapist and a wellness and mindfulness coach. So I come to this as a learner as well. And the other is very important. None of this is, although this is directed at healthcare workers, none of this is implicitly about healthcare and healthcare delivery. This is about health and well-being. And one doesn't have to be ill. One doesn't have to be injured or even in the veteran combat wounded to have a focus on mindfulness. This is about how do we as human beings realize our full potential.
Yeah, thank you for that. Alison, for you, what is going through your mind now as you're contemplating what our healthcare workers are facing?
Yeah, well, and Eric, thank you for your comments. That really resonates with me. And I think the healthcare workers in VA, it's not necessarily unique to VA, the challenges that they're facing, but certainly we're seeing, high levels of stress and definitely burnout. And I think something, Eric, that you mentioned, just this sort of unpredictability and chaos in a way of, having surges of COVID, in the past couple of years, and then things kind of feeling like they're settling down and then increasing again. And so I think we're seeing that really impacting our workforce a lot. Yeah.
Eric, will you talk a little about how the neocortex revisits our response to events, to our experience, and the effect that that has on us?
Well, I'm not a neuroscientist, but but I stayed at a Holiday Inn Express, and I'm blessed and privileged to work with some really remarkable people. One of whom you've already met, I think, in the past. That was Amishi Jha at the University of Miami. My understanding is that that the neocortex, that is the thinking and rational part of the brain, is not one of the first to get engaged in most events. Most of what we see and experience as humans is first processed through the emotional centers and memory, the hippocampus and the limbic system, especially the amygdala. And as a consequence of that, oftentimes our first reaction to events, and I think that this was adaptive in human evolution and human development, was to link it to an emotion that would get us supercharged to resist or to escape a life-threatening event, and then search our memories for something similar that would let us survive this by harvesting lessons learned from past events. And so oftentimes the first and foremost response is an activation response, is the fight or flight reaction that people experience when they think, oh my gosh, this is something I've seen before. This is something that was associated with terror. And we get this loop between memory and emotion. The thinking part of our brain, especially in the frontal lobe, has a difficult time penetrating that. The thinking part of our brain is trying to say, well, wait a minute, let's time out here for a second. Maybe this isn't what we think it is. How can we ratchet this down out of the fight or flight? And for that reason, I think over thousands of years, I think those who really introduced meditation and its extension in yoga and some other practices, yoga and these other practices, I hope Alison will agree, are meditative practices that allowed meditators to focus on the body and to maintain a meditative state for a very prolonged period of time. Those people discovered that one of the antidotes to the fight or flight reaction started with breath, that the act of breathing introduces the counterpart to that activation response, that fight or flight reaction, which is a relaxation response that ratchets it down and flips the switch into, okay, wait a minute, let's stay focused on the present and present reality, and let's stop this endless churning that's going on, this rumination that's saying, oh my gosh, I've seen this before. Oh my gosh, where are we headed with this? Catastrophizing about the future, guilt and remorse or fear about the past. And that's how I see the dynamics from a standpoint of almost a layman's perspective. I hope I'm correct, Alison.
Yeah, no, that all sounds right. I mean, I think, the mindful awareness really, as we talk about, helping you focus in on that present moment, what's important to you, what's happening at that time, I think does really help, kind of get us out of that rumination. And you're right about these other practices, maybe not meditation, but yoga are very meditative. And, a lot of yoga from its roots, the movement or the asana practices were actually to help so that the body, as you were saying, Eric, could sit in a meditative, practice for long periods of time.
And I'm always struck that my favorite, I should have a t-shirt that says I do yoga for Shavasana, which is the corpse pose. It's the pose where you lie flat on the ground and you remain absolutely still. But I'm told by yogas and yoginis that that's actually the most difficult position in yoga, not physically, but because you're not constrained by anything other than gravity. Your mind then is liberated to start going in 1,000 different directions in puppy mind. And the challenge then is to, how do we tie the puppy to the post? How do we bring the mind back to the present moment? And I think that pose and others like it are really reminders that the essence of these practices is what Alison referred to as present mindedness. Let's move into the present state and present mind and deal with reality as it is now.
Which sounds great. It sounds like the thing to do. But we all know it's not as simple as that. And when we're in that, what you described, Eric, we can become easily convinced that our thoughts are facts. Our thoughts about our past experiences, past trauma, and how we ought to react to what's happening now. Our thoughts can be very, very alluring, right? So what does that look like in practical terms if you are caught in that kind of loop? Alison, I'll ask you, how does that response to stress play out? What does it tend to look like in practical terms?
So if a person were stuck in that cycle, I think, you could get really agitated, stressed, that flight or fight kind of mode that Eric talked about. But I think, something that we try to do in whole health and with mindful awareness is really, again, just kind of bringing the individual back to the moment that they're in. So whether it's the busy healthcare worker, on rounds, or a veteran at home, really helping to kind of bring those tools and practices into their life so that they can, kind of get themselves out, I would say, of that cycle.
So let's talk about the mindfulness practices that the U.S. military in particular has been employing to meet the challenge of PTSD and of I guess the stress that's a few levels below even PTSD. What range of practices are in play, Eric?
Well, with permission, before we launch into that, I just want to make one other comment about what was just said. It helps me to remind myself almost repeatedly that these thoughts that we have in the setting of this fight or flight reaction that we've been talking about, in my most rational state of mind, I recognize are fictions. Mm. They're made up by my mind. When I sit and talk with groups of, say, kids in school or just others that we're talking about mindfulness, I say, how much of these future projections, whether they're you winning this upcoming, tennis match or big football game, or fears about what's going to happen in the pandemic or to this patient in front of you, how much of that is reality? And most people can recognize that future projections aren't reality because they haven't occurred. Then I say to them, how much of your memories and what you recall and how you digest that and frame that is true, is reality? And almost everybody says, "Oh, well, it's taken place. It's real." I said, "Well, then, have you seen any courtroom procedures recently? Have you listened to two people on opposing sides of a single event describe what that event was?" I mean, we've had a lot of very high-profile trials recently. Aren't you surprised at the number of people on one side who describe an event completely differently than people on the other side? That's what your mind has done. And it's processed it through all kinds of religious and family and social kind of contextual prisms. So you've digested past memory in a way that's very unique to you and doesn't resemble necessarily what reality might have been. So it helps me that when my mind begins to go there, to say, oh, wait a minute. Remember, as you said, thoughts are not reality. Thoughts are not who I am. Thoughts are not even what may have taken place or will take place. They are my creations. And then very important here is what Alison keeps referring to, this awareness. We as humans, and maybe we're the only ones who have this, we have this very unique gift of awareness where we can step back from that and watch your mind go through this and say, wow, isn't that interesting? Aren't I an interesting little fiction writer here? Here we go again with the thoughts. Here we go again.
Even having that piece of insight, right? That piece of information. Oh, my thoughts might not be facts. My experience might not be absolute, Even that is kind of the beginning of this mindful awareness that we're talking.
Absolutely.
Absolutely. I think that is probably one of the most important discoveries of these people thousands of years ago who said, gee, there's this other part of me that's able to observe not just the world, but internally is aware of what I'm thinking about as a separate individual. And I think most of us came to understand that, but didn't know how to harness that. Gee, there's this other element of me that's actually standing back from and can observe what my thoughts are. And as you said, that then leads us to say, gee, maybe these memories that I'm recalling, and maybe these projections about this patient and how they're going to do, or what the economy is going to go through, or whether I'm going to make my house payment. Maybe those are just projections based upon things that I am in a sense almost conditioned to think about this way, as opposed to what is potentially out there. And so let's just move back into what we know as we. I think there's this great line. I have it on a refrigerator, and I wish I had it in front of me, but it's from the Dalai Lama, who says there are 2 days about which you can do nothing: yesterday and tomorrow. The only thing you have is today.
Alison, can you talk about, what happens when we're able to kind of harness the power of that? What difference has that made in your life? What difference have you seen it make in the lives of the veterans that you work with, for instance?
Yeah, I would say, even if you think about, in VA, we have sort of formal mindfulness meditation practices or mindfulness-based interventions. And then we also talk a lot about, mindful awareness. So even that, just going through the day-to-day tasks of, let's say, washing the dishes and really just noticing the temperature of the water on your hands or the feeling of the soap. And I have found that it helps bring a little bit more kind of joy or happiness in a way to each of the things that I might be doing, personally throughout the day. And so I think we found that, and others too. And I think there's just such power. And we were talking about this just a minute ago about this, we are going to have thoughts of the past or of the future, but a big part of mindfulness and mindful awareness is kind of, taking note of that, noticing these thoughts that you are feeling, and then bringing it back into the present moment, maybe having a little gentle curiosity about that thought that you're having, but then just bring it back to this breath, this moment. And again, personally, I feel like it's just had a huge impact in terms of living almost a more full life in a way. There are, of course, days and times that I go on autopilot, and it's like, oh, where did those past hours or days go? So just really really being there for yourself or others, I think is just a huge benefit of it.
Yeah. I have the same thoughts as you do, Allison. I mean, I'm struck by, recently we've had this miserable weather for us in the DC area, with snows and freezing temperatures and the like. And, it's easy to get caught up in the negativity of the moment and say, oh gosh, I got to get my winter stuff on. I got to go out and shovel again. And I'm probably going to pull my back again. And, and on and on and on. But then if you stop and say, oh, wait a minute, let's just look at the moment for a second. Let's just spend a minute thinking about how weather varies the way it does. And let's look at birds trying to find something to eat. Maybe we could help out with there. And, I mean, this seems kind of mushy, squeezy, but it's amazing what, as Allison said, what you can notice when you take time to notice things. The beauty in things that are otherwise could elicit distress. Now, that doesn't help you necessarily in a battle situation or when you're in a miserable circumstance, in an ICU with a desperately ill patient, but you can dwell on the moment of seeing the humanity in that, seeing the compassion that an individual team worker can do, acknowledging that compassion. I was struck when my own father died a decade ago or so. Some of the most compassionate actions that I saw in that environment, and this is an environment where my brothers and sisters-in-law and wife and I, we all spent time with him in the hospital, so he was never alone. And so we saw all of the interactions of the healthcare team and others. But the thing that struck me the most was the care and compassion of the custodian who came in every day and cleaned the room and made a point of saying, oh gosh, look over there, there was a spill. We don't want that there. There's some urine that has been spilled under the bed. We don't want that there. We want to, and let me fluff your pillow for you. I mean, that kind of event, I think I would have overlooked in another circumstance, but those are mindful experiences in my view. I don't know. And so I say to our healthcare workers and with whom I sympathize and share some of those experiences of desperation and almost fears of futility. The humanity of what you're doing and what your team is doing is so profound. It really deserves your mindful attention to it because it's such an irreplaceable part of the human experience.
Wow, that's an incredible framing of it. That it is not, I think I want to hear you say more about that, or Allison, hear what comes up for you when you hear Eric say that, because it takes that lens of mindful attention to a place that was unexpected for me.
Yeah, no, very, very powerful. Still just kind of processing that. And it does make me think, and I do feel like, part of, I think what we're doing in VA, for example, with this transition and transformation to a whole health system, I think is trying to bring in more experiences like that, like what Eric just mentioned. And, the moving away from this real disease-based sick care model, rather than asking veterans, what's the matter with you, asking what matters to you, and having those conversations at all different levels, from the clinical care provider to somebody who might be making up the bed, really having that sort of mindset and that thoughtfulness and that mindfulness and every interaction, within the system. And I think that's the ultimate goal.
Yeah. I think when we ask people in a healthcare setting, what matters to you, as opposed to being fixated on what matters to us, which is often, frankly, just survival. I don't mean self-survival, I mean for patients. What patients, I think, tell us repeatedly is, I don't want to be isolated and alone. I don't want to be in pain. I'd love to be surrounded by my family. I want to be present. And I want to have some choices. We tend to infantilize patients. We tell them when they eat, when they get up, when they go to sleep. We oftentimes wake them up to ask them if they're sleeping. I've been through that as a patient. When nurses come in every 2 hours and wake me up and say, "Were you sleeping?" "Yes, I was sleeping." Oh, okay. I have to make that a note in the chart. So in that way, just in the direct healthcare environment, one of the things that mindfulness can help us with, I think, is to be mindful of what that individual and what that family may have relayed to us are central to the patient. Taking into account survival, I understand that. But if you're not there and engaged with that patient in some way within the limits that you can, even in an isolated, quarantine setting, holding their hand, whispering in their ear, constitutes something that matters to them, that matters deeply to them. I once had, when I was doing much more practice and was in ICUs, and I'm an internist by training, and I did a lot of work with desperately ill patients, many who unfortunately went on to die from cancers and other serious medical illnesses. I remember working with a nurse who had been a nurse for like 15 years. And he was terrified that someone would die on his shift. And we had a long conversation one night. And his terror derived from the fact that if someone died on his shift, he felt he would probably break into tears. And he would demonstrate that he had emotion about that he had lost a patient. And I said to him, what is that fear based on? And he said, well, they would see how much I'm invested in this, and they would think that I was weak and ineffective as a nurse. I said, if my mom died or my wife died and you were taking care of them and you broke down in tears, my interpretation is, gee, if you could get so invested in my wife or my family member that in a few days you experience sadness with their loss, then you came that much closer to what it feels like to be me. And your expression of emotion in that setting, in the moment, to me is a very legitimate and reassuring expression that you were doing the best job you could for my family member. And again, what he was caught up in was this forward projection of what people would assume he would be like if he did what he did, as opposed to just being present and acknowledging and being aware of what he was experiencing in the moment.
There's a lot of freedom in that.
Yeah. I mean, and you've seen this now in the news. Can you imagine how hard that ICU nurse, where mortality even before the pandemic, sometimes was up to 30% in ICUs. Can you imagine how hard he had to work to make sure a patient survived his shift, even if they were so desperately ill that 1 minute after the shift ended, the patient died? I mean, he worked so hard to get back to your point of freedom. The one thing I would mention to our audience is be careful when these thoughts begin to come in, these we are storytellers. Humans are storytellers. We love telling stories. Look at the stories that we're telling right now. And I think that, again, I think that's really been a very, very important part of how we have survived as a species, is that we were able to capture events in our mind's eye and then make a story about it that then helped us for the next time. But those stories can also be maladaptive. And if we're not careful in this meditative state, when we see ourselves drifting off, which we will, I hope Alison will reassure me that, and everybody has said, in meditation, almost everybody, this notion that your mind is clear, oh, nonsense. I mean, every practiced meditator says the same thing, that we can't stop after a couple minutes of this. You find yourself wandering off. That's not a problem. Just gently remind yourself, oh, I've started to drift off again, and think about something. And I'm going to escort my thoughts back to the present moment. I'm going to sweep them, as John Kabat-Zinn says, to the edge of the stage, and I'm going to come back center stage to the present moment. But there's a tendency then to say, well, why did I drift off into that thought? Let me think about that thought. That's a thinking about a thought. And you need to be careful. You better be careful not to be self-analytic in the context of meditation. You can park that aside and maybe go back to it later. Why do I keep coming back to this? Maybe I hate my mother. But I'm being jestful where I shouldn't. But I think you need to be careful not to become analytic in the context of trying to come to center stage. And maybe that's too sophisticated a thought to think about.
But there are other, we have other tools for that, right? You can.
Right. You have other tools for that, other times.
Write in your journal or.
Yeah, exactly.
What did you want to add?
Yeah, well, I was just going to say, I think, Eric, you hit that right on the head there with the, mindfulness practice. A lot of times I think people do think about meditation or mindfulness as sitting and having, no thoughts, but a big part of mindfulness practice is actually the noticing, that awareness of the thought you're having some, maybe curiosity about it, and, kind of setting it to the side, bringing it back to the present moment. And so just even that noticing of that thought and then coming back to your breath or focusing on the body, whatever the practices that you're doing, that right there, I mean, that is mindfulness. And something else to, again, share with the audience of healthcare providers, I think something that we're looking at in VA is how do we try to incorporate some of these practices for, provider, clinician, self-care, who's very busy, who doesn't have a whole lot of time. And again, a mindfulness or meditation practice doesn't have to always be, sitting for 45 minutes for your practice. That might be your practice one day, but it could also be, bringing in a moment of focusing in on your breath or noticing your feet rooted into the floor to help bring you back into that present moment. So I think a big piece of it also is having this compassion for ourselves and sort of this gentleness of, if I can't sit for 20, 30, 40 minutes a day, I still can, practice mindful awareness throughout the day. And so not giving up just because you can't have that more, formalized, longer practice.
No, I think that's really important as a practical point that you make, Alison. And to get back to the earlier conversation or the question you asked, Steph, is what things are we introducing in the military? Well, one thing is that this is an experiential endeavor. It's not an endeavor that you get good at by just listening to people like us talk or reading books about it. You have to do it. You have to do it and experience it yourself. And so there's work now going on, and Amishi Jha has helped immeasurably with the Army on this, with the support of a lot of Army leaders who found that this is very helpful. I mean, there are some compelling stories about leaders and others who in combat environments or in multiple repeated iterative deployment experiences, sometimes numbering in the dozens. Some of our soldiers, sailors, airmen, Marine Coast Guardsmen have been deployed dozens of times over the last 20 years, have found that a mindful practice has helped them maintain their sensibilities, their relationships with their families, have really restored their mental health, for lack of a better term. And they could not have done that had they not had some kind of mindful practice. And sometimes that mindful practice, once one gets good at it, and it has to adhere to some particular disciplined approach. This is what Dr. Jaw has been working on, and others as well. It's not something that you can simply do, in your spare time occasionally. You have to go through some formal disciplined approach to learning what that experience is like. But over time, just doing it for a couple minutes at a time, spread out through the day, as Alison was alluding to. I like to think when I watch a baseball game and a batter is at the bat and steps out of the batter's box, and I watch them, and almost always they take a deep breath.
Mhm.
And I like to think that what they're doing is a very brief mindful exercise to come out of the fight or flight into the relaxation mode, not think about, I'm going to hit a home run, I'm going to hit a home run, I'm going to hit a home run, but rather let me deal with the present moment and the next pitch, and you see that all the time. And the military has been doing that for a long time. It teaches people that in those environments, you take a breath and you focus on the event or the challenge in front of you, not let your mind race. And I think a disciplined approach now is one of the ways that we're doing. We're also using yoga and other applications that Alison is responsible for within the Office of Patient-Centered Care and Cultural Transformation, beyond just yoga and meditation, acupuncture and guided imagery, and many of these evidence-based approaches to comprehensive wellness, as well as to helping with states like post-traumatic stress and post-traumatic stress disorder. In fact, I think Amici's work has shown, and others, that these practices, if applied in a disciplined way, help prevent the later development of post-traumatic stress. And for those who are experiencing post-traumatic stress and post-traumatic stress disorder, where it's begun to interrupt their lives through intrusive thoughts, sleep problems, tendency to drift toward using alcohol or drugs to get sleep, which is the soldier's old friend. That was one of the ways that soldiers, going back probably to the invention of warfare, got out of these intrusive thoughts and sleepless problems, is they turned to alcohol. Family disputes and some of the irritability and family discord that results from that. One of the ways that we're approaching this now, both with the active as well as now the veteran, through what Alison is doing, are these mindful practices.
Yeah, it's a powerful tool, and it's making me feel like I would love to practice with both of you right now. Then if you would.
Sure.
Yes.
Yeah, it would be my pleasure. So I will invite you to just get a comfortable position, so you could stay seated or stand if you prefer, and just sort of settling in. So really taking a moment to move around a bit in your chair if you need to find that comfortable spot, that comfortable position. Then I invite you to close your eyes or just lower your gaze if that's more comfortable. Just taking a moment here to bring your attention to your body and your breath. Starting with the breath and just noticing the sensation as the breath comes in and out of the body, perhaps a gentle movement of the abdomen or the chest. Perhaps noticing the sensation of the air and the breath as it comes in and out of the nostrils. And I invite you to bring the attention to the feet. Noticing the feet planted on the floor. Perhaps noticing any gentle pressure between the feet and the floor. Noticing the sensation of socks and shoes if you're wearing them on your feet, or perhaps the temperature of your feet. And then taking the awareness from your feet to the lower legs, up to the knees, and just noticing any sensations or lack of sensations you might be feeling in the lower legs. Moving the awareness now to the upper legs, perhaps noticing any places where the upper legs, the thighs, the sits bones might be making contact with the chair beneath them. Taking your awareness now to the torso, the back, abdomen, and the chest. Again, checking in with the breath, noticing any subtle movement here with the inhale and the exhale. Bringing the awareness now to the hands, noticing the placement of your hands. Noticing any sensations or perhaps the temperature on your skin. Then taking your awareness from the hands to the arms, up to the shoulders, taking a moment to notice your arms as a whole. Bringing your awareness now to your shoulders, noticing if you can release or let some more ease into the shoulders. And then bringing your attention to the head, starting with the jaw, noticing any sensations in the jaw, perhaps even moving your lower jaw a little side to side to help release. Noticing the mouth, the tongue, the lips. Bringing your awareness to the nose. Again, noticing the sensation of the breath as it comes in and out of the nostrils. Noticing any sensations behind the eyes or the space between the eyes and the eyebrows. And then bringing your attention to the sides of the head, the ears, the cheeks, the back of the head, now the top of the head. And for the next couple of breaths, just noticing your body as a whole. Perhaps imagining the breath traveling up the body from toes to head on the inhale. Traveling back down from head to toes on the exhale. And then finally bringing your awareness and attention back to the breath, the gentle rise and fall of the belly or the chest with each inhale and exhale. Starting to bring a little gentle movement back into your body, wiggling fingers and toes, perhaps blinking your eyes open if they were closed. Just taking a moment to take in your surroundings, taking in the space that you're in, and then bringing your attention and awareness back to our session. Thank you for that invitation, Steph, and thank you for following along with that practice.
Thank you.
I have to comment, mindful of the time, but I just love the fact that as Alison kind of guided us through that body scan, that you have the ability to focus on different parts of the body on demand. I mean, your sits bones are always in contact with the chair and your feet are always in contact with the floor and on and on and on. But you're able to kind of laser direct at will toward it. And one of the things that John Kabat-Zinn discovered when he began to apply meditation to pain management is those who are in pain, and chronic pain especially, will describe being overwhelmed by this continuous painful sensation. And yet he was able to see, when he put himself in painful postures for a very long time, that his awareness was not in pain and was not suffering. It was his body that was suffering. And he began to separate that. One little exercise I like to do, even which happened when Alison was talking, is if I get an itch, which is low level pain, I don't scratch the itch. I work on coming back to my breath and noticing that when I come back to my breath and follow Alison's lead, the itch disappears over time. The itch isn't present there. And I think that's one of the skills that mindfulness does help you and meditation does help you with.
Yes.
Certainly helps me.
Absolutely.
Yeah. And the great news is that it is a practice and that you can work that muscle the way you would work any other muscle and gain increasing facility with it. And as you've both said, be able to use mindful awareness, even if all you have is a moment. I mean,
a traffic spot, I mean, it's said often, when you're in a metro car or a subway or you're at a traffic stop, and you spend that 90 seconds in a short mindfulness exercise. It's remarkable.
Absolutely. Oftentimes, and in my office or offices that we work with, or within healthcare centers and the VA too, we often try to maybe start meetings or rounds or different events with a brief practice, and it might be a minute, might be 5 minutes, but just having that sort of transition period between what you were doing, what you're going in to do, so that you can come in, fully present.
And I love the fact that you often, Alison and others, will include in that mindful moment a commitment, a mental commitment for everybody that you're going to be focused on the moment. You're not going to be drifting to the next meeting or ruminating over the last meeting or what you're going to have for lunch or anything else. You're committing yourself to be mindful in this moment, in this meeting.
Absolutely.
I think that's really a cool tool.
Yeah, it's a gift to ourselves and to everyone we encounter, right? Well, I was very glad to encounter both of you here in Zoom this morning. Thank you so much for being part of this conversation and being part of this Healing Healthcare Summit.
Thank you,
Steph. Thanks for what you're doing. Alison, thank you so much for what you do every day for our
We're
veterans.
lucky to work with you, Eric.
Terrific.
Alison Whitehead and Eric Schoomaker, both joining us today for Healing Healthcare. You can find out more about a lot of what we talked about, including the work of Dr. Amishi Jha and what the US military is doing as it employs mindfulness, about how our brains respond to volatile, uncertain, complex, and ambiguous times, such as the very ones we're in, at mindful.org. You can also find dozens of digital courses that you can do at your own pace, led by expert mindfulness teachers and designed for usefulness in your everyday life. You'll find that variety at learning.mindful.org. And before you go, if you're moved to, please rate this session. There is a rate session button below the video in Whova. It should only take a minute to do, and we find your input very helpful indeed. Thank you so much for being with us, and take good care of yourself.
Thank you, Steph.